Namaste, everybody. We had an overwhelming response after Sri Malhotra's interview with Dr. Anil Kumar Dikshit from the Prakruthi Ayurveda Prathishtana in Mysore last week. And today we have with us Dr. Dayananda, also from the Prakruthi Ayurveda Prathishtana in Mysore, to answer some of your questions. So, Dr. Dayananda, namaskara.
Namaste.
Very happy to have you here, and thanks for making the time. I'm going to move the questions that people have had, starting with Dharma's question, which talks about Dharma asks, following Ayurveda Dinacharya is so tedious, it is almost depressing. Why is this so? Why has Dinacharya not been sort of modernized, is what she wants to know. Why is this so tedious to follow?
Frankly speaking, it's not so tedious. It is the fact that it is the way it has to be done. Like, as we know that the day and night are equally divided, of course, to the India. And similarly, the human beings are not changed from generations also to now. And it's a method where the immunity or the survivability of the body will be developed by those procedures. We can't shortcut them, but it can be selected according to the person and the seasons. The modifications can be done with the medicines or the media what we use can differ. Just to take an example, I don't know how it is feasible to this. If we, instead of eating food, can we go with the vitamins and minerals and the tablets which can supplement the protein, vitamins and other things? Is it okay? No. So we need food as things of something to chew, something to digest, and then evacuate. So it cannot be. There is no shortcuts. If you do the shortcuts, you don't get the benefits. Like it is only there for short term.
Mm-hmm. Now, for example, modern day with people working for more than 8 to 10 hours outside the home, how is it possible to make freshly cooked food and then eat that because people are not at home cooking?
So in that cases, I preferably I can ask the person who doesn't have time to cook, go with the fruits. That's the best idea. And for me, fruits are the ready-made foods because you just don't need to peel it off or open it and eat them. So if you need to go with the real food, then the way we need to do it, we need to do it. And moreover, the importance of life has been changed. Like earlier, the work used to be a part of life. Now the work has become the life. So the main or the key point is to do the job. So I don't have time for many things because the job. So your importance changes, then the whole aspect will change. So the whole aspect of Ayurveda is to keep you healthy and sustain healthy till your last breath. But here we are doing for the job, sake of job. So the priority will define that which is important, which is not important to that.
Okay. So if you do go to work, then may change your lifestyle so that work doesn't consume you. And also, if you're going to work, take fruit for lunch or something like that. If you're instead of eating pre-prepared or frozen foods.
Definitely, yes.
Okay. Nihal Jain has a question. Can't we have something similar to vaccines in Ayurveda? Is the question from Nihal Jain.
Yeah, it's a best question, I believe, for the current discussions. Because vaccines, if you look at that, when we were kids, we had only few. Now it has been modified. We are getting many vaccines now. And now it is concised also something we call pentavalent, where the 5 vaccines are combined together to give it a one shot. That means we are getting multiple shots with a multiple resistance or multiple disease to as a prophylactic. Then how many diseases you are going to face with that? Rather than that, if you make yourself stronger, that you are not susceptible to the disease. That is the idea behind Ayurvedic thinking, where we have like Bala, which is called as, we call it as Bala, like Sahaja, Kalaja, and Yuktikruta. These are the 3 headings which we can look at that. Sahaja is something like where our ancestors, like our parents, were stronger when like the person has conceived at the middle age at the right time, that is more stronger. And then it goes with the time of the conception and the place and everything. That is something which they're acquired during the birth. And Kalaja is like childhood, engage, and old age. Particularly age, we have some resistance or the where we can fight with the diseases particularly. And then with that, particularly with goes with the seasons also. The third one is Yuktikruta. That is where you have the knowledge or the idea to modify or implement the better things to improve your immunity. That is through the health, with the food, lifestyle, and there are some medicines which called Rasayanas, which can be taken as a Nitya Rasayana daily. That is a food. That's the main thing. Apart from that, there are like Triphala, Amalaki. There are certain things which are need to be taken at a certain period of the time with certain regulations. But to make it generalized, it's a little bit difficult task. So the person has to go to a doctor, Ayurveda doctor, and consult. Then they can personalize it according to their desha, that is the place of birth, or their disease and the Prakruti. That makes the much more precisely we can go with that way.
Okay. Bharat from France has a question. I have for the past many years stuck to Ayurveda, consulting allopathic doctors only for during emergencies. But I have noticed that Ayurvedic doctors are ages behind in diagnosis. Even today, I go to allopathic doctors for diagnosis when I'm unwell, and then go to Ayurvedic practitioners with the diagnosis and ask them for medicines. So I think Bharat in France feels that the diagnosis in Ayurveda, Veda is not up to speed with the modern techniques that are used. What is your comment on that? Or is it a different drishti that we have?
First of all, I need to thank Bharat because he's following Ayurveda since many years. That's a good thing. The other way, what we need to think is here, in India, we have an collaboration. I can say that we can work with the allopathic doctors, or we can use the instruments or the tools which the allopathic people also using, like the techniques with the lab investigations, or the instruments like MRI, CT, and other things. But since he's from France, I believe that there is a limitation for Ayurveda. They take it as a wellness, where I don't have a solid thing to say that they have a more liberty to write for the investigations. So if it is in India, right, we have, but we have our own tool of examinations which can be adopted along with the modern instruments where the technology can be used. Definitely, there is no doubt.
Now, does Ayurveda have its own diagnostic capabilities that are similar to modern science, or should it be used in conjunction with the modern medical equipment that you have, instrumentation that you have?
We do. Yeah. We do have the technology or the methods to identify the diseases and diagnose. Like there are three main things, which says that Darshana by visualization, Sparshana by touching, and Prashna by the questionnaire method. In that, there are different headings. But the thing is now, the instruments, which are like CT, MRI, and those things, which we may miss out by these things. But there are techniques like Nadi Pariksha, which if the person is much more familiar with those things, they can identify it. But somehow it is not so popular that everybody knows it accurately. So in that case, you can take the help of the modern instruments or the investigation methods, which can help you out see the things beyond your vision. So it can give an idea that what might have the problem actually. Then you can try to incorporate in your science, rather than thinking that with a modern perception. For example, to say when you're looking at the blood pressure, we use the instrument too. But we try to look at the beats, whether it is sharp, showing the pitta, what is dull, showing the kapha, what is areatic, or the variations that is vata. This is how the instruments are absorbed to the Ayurveda system, but you're using them as a tool. So like that, we can use it. There's no issue in that. And we are using it also in India.
Okay. See, the Nadi Pariksha that you mentioned, why isn't it that not many practitioners, even within the Ayurveda system, are good at doing this accurately and doing this well? We have sort of failed to teach Nadi Pariksha well. Would you agree with that observation?
Yes, I do. I do agree with that. Nadi Pariksha, we are not. It is not transferred as such. And with the similar thing, there are other things also. Like for example, if you take Muta Pariksha, it is also not well practiced nowadays. But in our institution, we try to re-establish that, and we are working on that. We could able to see the prognosis of the patient with the Mutra Parikshas. So
Okay.
like revalidation, we can say some extent like that. If the people are there to try that, there are people to learn, but it needs a definite skill. because everybody cannot master with those things, because it's more like an inference one. It's something you need to feel the subjective and connect it to a material and then make it in your own expression you need to do. We can't see it as a lab thing everybody can visualize. That is not possible. So that how much you're aligned with that, how much you're tuned to that, that much you can be a perceivable.
Now, is the Ayush Ministry, see, the Ayush Ministry was established to sort of revive Ayurveda. Now, do you find that these sorts of areas are being given mukhyatvam, giving importance to revive some of these techniques? Or what is the Ayush Ministry actually doing, in your opinion?
Yeah, they have introduced a scheme called Guru Shishya Parampara, where they identify a set of Vaidyas who can teach or narrate the things as it is told in the text. It's going on, but still it is something, a personal level. I feel that when you go to Nadi Pariksha, something which, for example, I am going to examine some patient and some other doctor going to examination with the same Nadi Pariksha, they will have a little variations, depend on their perception. It's not limitation of the science, it's limitation of the individual. So I believe that it needs a lot of training and memorize the rhythm of the pulses to interpret them to get a proper result.
Right. Now, do you think Arul from Tamil Nadu asked this question, and this sort of is a follow-up. Is it possible for India in the future to completely switch over to Ayurvedic methods and do away with the Western system? And that's a question. If we do that, maybe we'll have more trained people. I don't know what your opinion on that is.
It is true that India used to have the only one way of system to treat for the healthy or the wellness, that was Ayurveda. Before, if you look at the history, before the invasion of many other people to India, it was that. We have lost the secrets and values of the complete science as it is, which is transferred in case of surgeries, emergencies. So still we need to rework. That's the area we need to be research done. But to take the replacement as a completely vanishing or completely removing the allopathic science and getting the Ayurveda, I don't think it's 100% will be possible, because there are good things. Here, the intention of the medical science or the life science is to make a person healthier and better. So whichever the mode you are using, you need to know the limitations, and you can always combine and work together at the same platform, under the same roof. So to give it better results within a short period or with a cost effective, that will be the better idea rather than thinking to replace something and make it a major one.
Okay, great. Arul also has another question. He says, can Ayurveda treat the diseases like AIDS or cancer, which cannot be cured by Western medicine? And can it cure it completely?
That's a good thing to, like, I got the question because recently I'm working on cancer since a year. So in that, I could able to see that we could able to work with the many areas, but still the research has to happen. The thing is, like, we can, if usually when you say the disease which can be treated, we have the classification like easily treatable with difficulties, and then maintenance, and the other one is incurable, where you have to go with the medicines for a long period. So the cancer and AIDS are the certain diseases. If they get established completely, then the body is weaker. When the body is stronger, you are able to fight it and get the good results with a stronger medicines or the different methods of panchakarma. But when the body becomes weaker, it is quite difficult. So depending on the severity of the disease and the strength of the person, it can be said that it can be a curable, maintenance, and these things. So that has to be, like, always say that it's not a complete thing to challenge this, say that we can cure it.
Also, is it correct to say that most people come to Ayurveda as a last resort after the disease has sort of overtaken and the body has been weakened? If they came to Ayurveda initially at the start of the disease, you might have a better chance of curing it. Would that be a correct observation?
No, exactly what I'm saying, the same thing. When the body is stronger, that means the disease is not established completely. That is a time where the body is stronger, we can do panchakarmas where the body can withstand. To give an example, that if you have a little dirt in the wall, you can just wipe it off, it's okay. If it is stuck for a long period, then you need to soak it or use the detergents. If it is much more stronger, you need to repaint it. So in this way, if the body is stronger, then only we can help it out to do that. And with the cancer, as I was telling, that we are doing it as a preventive. We are associated with the things like whenever the person is taking a chemo and radiation, we are helping out to reduce the intensity of the secondary complications what they're getting. And somebody who is in a palliative stage, we are helping out with the medicines, with the simpler formulations where they can have the better quality of life and the span of life. Where the cost is the thing which we need to always consider, because cancer treatments are highly expensive, so it is making a burden to the family also. So this is the way we can help it out also. We are working on that, and still we are getting a good results.
And are you publishing those results?
Since a year I am started, so I need some documents to be, but as I told, I'm going with the modern tools also. We are doing PET scan, we are doing tumor markers before and after, like as for the normal standards. So every 6 months we are going PET scan, and every 2 months we are going with the blood reports also. So that will make a data, and future definitely, yes, we are going to publish some papers.
Okay, good luck on that venture. There is a question from Shivakumar Bhatia from Mumbai, who asks, does fasting help to fight the coronavirus?
Fasting is a best tool, but to take it as a complete fasting, nowadays we get a multiple methods of fasting also in the net if somebody is searching out. But here the idea is, whenever a disease starts, usually it will have an impact to our Agni, which is the digestion. We can say it is a transformation things which is there in the body. So to improve that, we can use fasting, yes. But certainly it depends on the type of person. If the Paitika person, Pitta dominated or Vata dominated, they can't do complete absolute fasting. They need to go with the lighter meals and then the activity which can help the body to heal. So fasting is a tool, but how to implement it and what extent. So initially it can be useful for 1 or 2 days. For example, to say that if you have a common cold or rhinitis and other thing, naturally you don't feel hunger.
Right.
So don't eat. That itself shows that the body doesn't need the food. So that is a fasting. There, if you want to enhance it, you can go with the hot water. If you want a little bit more, then you can go with the hot water with ginger or ginger boiled water. Like that, it goes on the medicinal side also with that.
Okay. And to follow up on the different Agnis, Girish Balasubramaniam from Lucknow asks, there are different types of Agnis are mentioned, Prana Agni and Jatar Agni and things like that. Can these forces be used to combat COVID-19? Does the Panchabhutas or any of them have a role in destroying, containing COVID-19?
Ayurveda considers 13 type of Agni, but the Prana Agni is not there as such in Ayurveda, but it's there in Indian science with the Tantric, or if you go to the other science, allied sciences of in India, there we have. But Ayurveda, we have 13 Agnis. That is Jatra Agni, which is the main Agni, which is there in the body, which is the digestive factor. And then Panchamabhuta Agni, that is 5. And then 7 Dhatu Agnis. Each tissue or the Dhatus has each Agni. Whenever the Agni is optimum, you don't get diseases. The whole idea of treating a person, especially the endogenous diseases, is regulating the Agni. If you regulate your Agni, that is the treatment. So there is no doubt that Agni is your immunity. That means if you're taken a food which is completely digested, completely absorbed to the body, each cell has its own food. That means, as we spoke a little bit earlier, the Sahaja, and then we have that Kalaja, that is with the season and the food lifestyle. So that is something which is helping it out to do that. So definitely if you keep your Agni, that is your treatment. But for the regarding the COVID, as I explained a little bit earlier during the fasting, that's a way we need to increase the Agni if it is reduced.
Okay. Getting back to Shivakumar Bhatia's question, Shivakumar is from Mumbai. My question is, will consuming Dashamula Kashayam and Pachanamrutam Kashayam on empty stomach and consuming Abhaya Rishtam after meals help my immune system become better? I don't know, this is a very particular question, but is this a general you can apply for everybody, or you have to look at the patient?
No, exactly. It is individualized. Maybe I think so
Okay.
that he has consulted some doctor. The doctor has given the prescription. But looking at the medicines which they're used, yes, it can help that particular person because Dashamula, it works on the chest to reduce the kapha, and the Pachanamrutam that will helps to digestion and keep the optimum digestion. And then Abhayaristam is a laxative, it keeps the Apanavata going down. That means your digestive system is getting optimized. For that person, yes, but to generalize, I don't go with that.
Ayush Verma has a question. It is believed that Ayurveda takes time to show results. So he's wondering, does the infected person with COVID take that risk of just hanging around and waiting till Ayurveda shows results versus just going to the Western medical system?
Yeah, just I would like to add my experience here. After my graduation, I was there in Kerala for about 3 years to learn these methods of Kerala treatment and other things with the teacher, Guru. And there I had an opportunity to work or to be with one of the Vishwavaidya. His name is Avanaparambu Maheshwar Nambodaripat. He used to treat snake poison only with Ayurveda medicines.
Okay.
So anything which is can cure or treat the poisonous condition with such an emergency, why can't it help in a infection? Infection, it is giving you a time. The poison doesn't give you much time. So there are medicines, but it need to be accompanied, it need to be individualized. It's not like something like one drug for all. So as there is individualistic way of Ayurveda, it is a confusing for the mass of the people, but it is a way, it has to be precisely giving to a particular person whenever it is required. So there is a confusion there. But definitely infections are treated in Ayurveda also. There is no doubt.
Pavan has a question. Can ashwagandha provide immunity against COVID-19?
There is always a brand or the methods say that ashwagandha is good for everything. It is true to some extent, but here ashwagandha is good whenever you want to have the muscle power, when you want to have the mind calm, when you want your anxiety to come down. So it is, that means every rasayana is not applicable or used for everyone at any time. We need to have a selection. For this COVID or the flu-like symptoms, what we have the Rasayanas called Dashamula Haritaki Rasayanam or Vagri Haritaki or Agastya Rasayanam. This is a thing where it has a scraping action of the mucous membrane and protecting the body not to progress the disease. So these type of Rasayanas are more beneficial here rather than ashwagandha as such.
Okay, and everybody can sort of take this on a daily basis during this time?
In that case, to make it general, I can say that if it's better, the person can go with Triphala with honey at bedtime. That will be the better one rather than going with the lehas. Because whenever you want to go with the rasayanas or the lehas, we need to see their digestive power, and we need to give in a divided dose, less quantity. So this thing is something which will require the intervention of a doctor or the Vaidya. Rather than that, if generally the people want to go with that, it's better go with the Triphala with 1 spoon of Triphala Churna with 1.5 spoon of honey at bedtime. That would be much more better to keep your respiratory tract better, and it reduces nasal congestion, and even it is good for the vision too. And it's a laxative, which is maximum people are suffering with the constipation nowadays. So it's laxative too.
Okay. And even for children, you can give this.
Children definitely you can give, but the dose has to be lessened down.
Okay. Bharat from France also has another question. He says, are there any ongoing or planned COVID-19 clinical trials that include Ayurvedic interventions that go together with the standard allopathic treatments? Yeah.
Ayush department has incorporating the ICMR, and they asked for the different protocols from all over the state. And if somebody wanted to have a protocol or an idea with the medicines, they can give it to them. And they're working on that. It's under progress.
Dharma asked the question, why is the conventional Ayurvedic knowledge not been interpreted in a modern way so people can understand? I think that's what she's trying to ask.
Usually, when we say the technology is the applied aspect of the science for the benefit of the uh, society or the to gain the knowledge. So here the tools are different, and the way where we interpret the things are different. As I told, we use the instrument like blood pressure, but along with the reading, we try to look at that whether is vata is more, pitta is more, or kapha is more, depending on the beat which we are feeling there. Similarly, the instruments can be used, as I told earlier, that we are using it and it can be incorporated. That's not an issue. And I would like to add one more thing. Ayurveda is, as she mentioned, it's old science. But I would like to add it like in a time-tested, and it is valid for generations. This thing, something make it more positive rather than when you say old. Old is gold is good, but it is not applied for everything. So I would like to address this, that we have different tools also, as I told, the Nadi Pariksha, and this is like the science applied for the public understanding. So terminologies may differ, but yes, definitely we use that. There is no doubt in that. But still, there are. I believe that it's not complete, but still, if you can use and analyze, understand the modern instruments to apply Ayurvedic science, that is always better. There is a scope too.
Okay. Okay. There is a question from Sai from Shimoga. He says Germany has 95% of the people surviving COVID-19, and UK has 95% of the people dying of COVID-19. I'm not sure about these statistics, but anyway, both countries have almost similar weather. And why is there a discrepancy in these populations? Because they are also sort of a homogeneous, they come from similar kind of race and ethnicity.
Now, even I don't have the data to comment on that, so I don't think I will be able to do that. So, if we have the data and we have the analysis a little bit, then we can speak on that rather than simply boosting on that.
What is the case that stands to you in your own experience? Can you talk about a case that you have treated very successfully where Western medicine has failed?
Yeah, as I told you that recently I started working since a year on the cancer, so I would like to take up that cancer as a part of discussion here. So I had a patient from a nearby place called Hubli, where they had a gland, which is a cellular, which is a gland which is swelling, which is below the mandible, and it was operated, and they didn't do the PET scan. Usually, PET scan is done to see whether it is spreaded. So it was maybe it was missed out or something. What happened? I don't know. So when the patient came here, I advised him to go for that. He went for that. We could able to find a little bit element which is spreaded to thoracic and the cervical region. We treated them with the panchakarma and then some medications. After 6 months, we could able to take the PET scan once again. We could able to see that the disease has not progressed and it is coming down with a millimeter difference. But the best thing what we could able to see is the 6 months, there is no progression and it started deteriorating. So this is something which I'm not saying that it is not possible with the modern science or it was the failure, but this is where we can also have an contribution, or we can also see the thing as a body to treat the diseases. Of course, the cancer, there are also a question that whether cancer is explained in Ayurveda, whether the COVID is explained in Ayurveda. This is something which always comes up. But we have the same tissues, we have the same symptoms which can produce by particular tissue in the body. So looking at those things, Ayurveda has explained that if you are getting this type of symptom, this is from that particular tissue or the dhatu and particular dosha. If you don't know a disease, you look at the condition, you start treating with the medication. It doesn't mean that you're going as a symptomatic way. We are going to take the line of treatment from different diseases which can affect that particular tissues. That means we have to formulate the line of treatment, but there is no standard one. You need to make up your own. So certainly I can say that it's helping out.
Okay. So it's a very customized treatment that Ayurveda provides for a patient.
True.
And you use Moola Granthas to figure out what the situation is and then apply it. So that becomes new in some way. Okay. So thank you so much for your time. And we hope to see you again and bring you back sometime soon. Thanks again and namaste.
Thank you. Thank you for the opportunity. Thank you.
Thank you for watching. You can subscribe here and also hit the bell icon to make sure you get notified. To donate, please click this button.